Yeah, got a hi from you. Good evening, everybody. So today we are live on Instagram with a topic understanding autism. So first of all, very good evening to one and all, and I heartily welcome you all in this live session. So today, in today's topic, we'll try to understand. We might have heard about autism. What exactly is autism? What kind of disorder it is? What are the signs and symptoms, etc. How does an autistic person behave? What are the characteristic signs and symptoms of autism? And what are the interventions? How can we manage a person who is having autism? So before understanding the intervention part, let us first understand what exactly is how it can be defined. So autism is a terminology. Autism is a term which refers to a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech, and nonverbal communication. So when it comes to a person who is having autism, a person with autism often behaves with certain things. He or she depicts certain signs and symptoms which involve basically it involves challenges in social skills. Socialization is a part which we all have to go through in our lives, right from the moment we start growing up, we develop insight, we develop intellect, socialization ka process keeps on going. So a person who's having autism faces challenges with social skills. Secondly, repetitive behavior. The person depicts repetitive behaviors, either banging head, banging hand, or banging legs on the floor, or on bed or any other surface. Then comes speech and non-verbal communication. Autistic person communicates, but does not uses language to communicate or to express himself or herself. So the person uses a non-verbal mode of communication, and it is very important to understand what the child or what the autistic person is trying to say. It is a complex developmental condition involving persistent challenges with social communication, restricted interest, repetitive behavior. Where did the term autism came from? Who was the pioneer? Who gave this word? Who was the pioneer or who gave birth to this word? The word autism was first used as a diagnosis in the year 1943. So this is not a recent terminology. This term was given in the year 1943 by Dr. Leo Kanner of Maryland's Johns Hopkins Hospital. After conducting a study on 11 children, he made a diagnosis of infantile autism. So autism को हम basically autism spectrum disorder भी कह सकते हैं, ASD, which is also known as autism spectrum disorder. Let us understand what are the signs and symptoms of autism. First of all, the autistic person will lack eye contact. A person fails to maintain eye contact. A person shows unusual or monotonous games. When we come across a child who is autistic, the child used to keep on playing some particular games in a very mundane way, in a very monotonous way. Then a person rejects social touch. If we try to touch or hug the person or tap on his shoulders or head, the person may refuse, the person might not like. So the autistic person rejects social touch. Inappropriate laughter is another sign and symptom. Repetition of words and phrases. The autistic person constantly keeps using certain words or certain phrases repeatedly. Underdeveloped sense of danger and reduced sensitivity to pain and difficulties in communication are the basic signs of autism. Apart from that, we have already gone through this. Lack of eye contact, reduced sensitivity to pain, unusual monotonous games, difficulties in communication, underdeveloped sense of danger. Nature and characteristics of an autistic person. How can we identify that this particular person is having autism? So there are certain, again, other symptoms also. social communication and interaction skills. So we can categorize this into various heads. The first head comes social communication and interaction skills. When we come across a child who starts growing up, who goes through the developmental stages one by one, we'll find that the child starts shaking hands, the child starts smiling. So this is how developmental stages, the child goes through the developmental stages. But a person who is having autism or a child is having autism does not has these developmental skills in a normal way. So first comes social communication and interaction skills. Avoids or does not keep eye contact, does not respond to name by 9 months of age, does not show facial expressions like happy, sad, angry, and surprised by 9 months of age. So autistic person के चेहरे पे, के face पे, communication पे, we cannot see, we cannot understand the emotions. The child or the person will be emotionless. Does not play simple interactive games like pat a cake by 12 months of age, uses few or no gestures by 12 months of age. So these are certain symptoms where again we can find out that the child's face or the child's body language even does not shows any kind of emotions, does not point or look at what you point out by 18 months of age, does not notice when others are hurt or sad by 24 months of age. So these are certain developmental stages or developmental milestones which a child generally achieves by this age. Restricted or repetitive behaviors. In the restricted and repetitive behaviors, the child will definitely use certain words multiple times. So this is known as echolalia in the field of psychiatry or psychology. Plays with toys the same way every time. It is focused on parts of objects, for example, wheels, gets upset by minor changes. For example, if a parent or the family members bring about a change in the child's room, then the child might not like it. The child likes it to be the way it was initially. Has obsessive interest, must follow certain routines, flap hands, rocks body, or spins self in circles, has unusual reactions to the way things sound, smell, taste, look, or feel. So any kind of change is not welcome by the autistic person. Other characteristics involves delayed language skills, delayed movement skills, delayed cognitive or learning skills, hyperactive, impulsive, and inattentive behavior. Epilepsy or seizure disorder is another very commonly found symptom associated with autism, which again parents or many a times professionals also fail to diagnose. Unusual eating and sleeping habits, gastrointestinal issues which can involve constipation, unusual mood or emotional reactions, anxiety, stress or excessive worry, lack of fear or more fear than expected. तो बहुत ज़्यादा डरा हुआ सा दिखता है. Let us understand what are the types of autism. So when we started with the PPT, it was mentioned autism spectrum disorders. Why this is actually an umbrella term which further involves sub disorders. So types of autism, this is known as pervasive developmental disorder, PDD, autistic disorder, AD, Asperger's syndrome, children disintegrative syndrome, and Rett syndrome. So these are the sub-disorders found in the umbrella term ASD. Let us understand these sub-disorders one by one, because it is very important to understand what kind of autism your child is having, which subtype of autism is your child suffering from, because again, the signs and symptoms of all the subtypes will vary, and so will the intervention. First comes PDD, NOS, that is pervasive developmental disorder, not otherwise specified. This is also sometimes called as atypical autism, or in short form, we can use PDD, NOS. People who meet some of the criteria of autistic disorder or Asperger's syndrome, but not all, may be diagnosed with atypical autism. So the symptoms involved here is deficits in social behavior, uneven skill development, poorly developed speech and language, difficulty accepting change, uncommon responses to taste, sight, sound, smell, or touch, repetitive or ritualistic behaviors, highly restricted and focused interest. Second comes the autistic disorder, which is also known as classical autism. The symptoms here are challenges with social interaction, communication problems, repetitive behaviors, tantrums, or meltdown. Such children often show tantrums many times, and which makes it very difficult for the parents and for the teachers or the family members to deal with. Sleeping and eating disturbances. Next comes Asperger's syndrome. The signs and symptoms involved over here are having impairment in social interaction, trouble reading facial expressions, body language, and social clues, not understanding irony, metaphor, or humor. When we communicate with such persons, they do not understand that we are making fun of something, or there has been some joke that people have cracked. So they do not understand that something humorous has gone. Next comes showing awkward body language, standing too close or talking too loudly, lacking eye contact, repeating the same behaviors and activities time and again. Next is childhood disintegrative disorder, which is also known as CDD. Another term for this syndrome is Heller syndrome or disintegrative psychosis. The symptoms over here are acquired language or vocabularies, social skills and adaptive behaviors, some motor skills, language and communication issues, play and self-care skills, bowel and bladder control. Rett syndrome or Rett disorder is again a neurodevelopmental disorder. When we use the term neurodevelopment means neurons are actually the brain cells. Our brain cells are known as neurons, and they are different from our body cells. When our body gets hurt, or when we get any cut or a burn in our hand or legs or any other body part, it gets healed up very soon. But if there is any damage caused to the neurons, it is very difficult for it to heal. So this is how neurons are differ from the body cells. Neurons, when are not properly developed or when are underdeveloped, they create a lot of problem with the person's cognitive abilities, because neurons are the brain cells are responsible for the cognitive functions or the mental functions which we carry, which our brain carries, like thinking, reasoning, planning, decision making, problem solving, etc. So these all functions are carried out by our neurons, and if the neurons are not developed properly, or if there is any delay in the development of neuron cells, then such kind of issues will be definitely found in a person. The common symptoms of Rett syndrome include spitting and drooling, uncommon eye movements, staring or blinking, sleep disturbances, irritability, language and communication, learning, loss of learning, loss of standard movement and coordination, breathing difficulties in few cases. How can we assess that a person is having what kind of autism is found in a person? What is the level of the autism found in a person? So like many other disorders, like many other issues, autism also can be found in or measured or assessed into multiple levels. So basically, clinical assessment of autism is made by mental health professionals, which involves psychiatrists, clinical psychologists. In fact, clinical psychologists are the person who can go with the assessment of a person with autism, that what level of autism is this person having. So, and the method we use for assessment of autism is through ICD-10, International Classification of Disorders, or Diagnostic and Statistical Manual version 4. This is what we use, and on the basis of this only we make diagnosis of autism. Many have begun screening for autism during child checkups. Many parents who are not having any knowledge about this thing, they visit a GP, they visit a doctor, and then the doctor refers the child or the family members or the parents to a psychiatrist, to a mental health professional. So the person may be referred to a psychiatrist, and then the psychiatrist might in turn refer to a clinical psychologist for an assessment to know to understand the level of the autism of that person. So on the basis of signs and symptoms, it can be clarified that this person is having autism A, B, that this person is having this particular subtype of autism. Autism checklist. These are certain things, certain points which you on your own can understand that, yeah, my child is having or my family member is having these symptoms. So these are there is chances that it's co-autism too. Consider your child in terms of the following behavior or responses. When you call your child's name, they consistently turn their head? An autistic person, when called by his or her name, might not turn to you. So that person is the person is either not understanding or never have heard about him being called. Does your child make direct eye contact with you as much as other children do? Does your child look at toys you show them? When you play with your child, do they smile at you often? Does your child use body language and gestures to communicate with you? For example, pointing, waving, showing objects, and reaching out. If so, do they use eye contact at the same time as using a gesture? Does your child exchange sounds or words with you back and forth? So these are certain things when you communicate with your child, you'll be able to understand the what kind of communication is the child using to answer you back. And if the child is not using proper communication, if the child is not answering you back, in fact, then there are certain chances that your child is having autism. There are certain autism screening tools which are used by mental health professionals and clinical psychologists in particular. These screening tools are modified checklist for autism in toddlers, MCHAT, ABC, Autism Behavior Checklist, Autism Spectrum Screening Questionnaire, ASSQ, Childhood Autism Rating Scale, CARS is a very commonly used tool, Autism Diagnostic Observation Schedule, ADOS, Autism Diagnostic Interview Revised, ADIR. Revised, why we are using the term revised? Because the questionnaires in this test were revised, were felt that on particular population, the questionnaire is not suiting or is not fitting appropriately. So there was some changes made in this questionnaire. The social communication questionnaire, that is known as SCQ. So these are the autism screening tools which are used to understand the level of autism a person is having. Let us now understand what can be done if a person has been diagnosed with autism. There are many disorders where treatment is possible, but autism is a disorder where doctors say that it cannot be treated, but it has to be managed. It has to be handled. It has to be taken care of by the family members, and it cannot be eradicated completely. So if your child is having autism, it's like that you have to live with that condition. You have to understand what kind of management strategies you need to use with your ward. Autism has no cure at present, in spite of so much development in science, in technology, in so many other things. There is actually no sure short cure of autism. It is a complex disorder with various manifestations. Again, these manifestations may vary from person to person. Even if two person having Rett syndrome or any other subtype of autism, they both may show different, or they may have variety of symptoms. So here it is very difficult to say that yes, this person with autism is having same symptoms with the other person who's having autism of some other type. The aim of treatment is to lessen associated difficulties and deficits and to improve quality of life and functional independence. No single treatment is best, and management needs to be tailored to the child's according to the child's needs. So we cannot say that this particular method of treatment or intervention is suitable for this person. You have to understand the child, or you have to understand first the nature of the autistic person, what are his or her needs, and then we have to tailor or customize according to the needs of the person. The management of ASD from the clinical perspective encompasses both interventions in family or environment as well as intervention addressed to the patient. What exactly will be involved in the intervention or management plan? Intervention target improvement of what basic things are covered in the intervention. Social interaction, first and most important thing, will work on the signs and symptoms which are deficit in the child or in the autistic person, which involves social interaction. So we'll try to develop social interaction skills. If the child is using non-verbal methods of communication, then again, we will also try to communicate with that person in the similar manner. Social interaction skills of the child so that he or she can understand other people's feeling and respond to them. Communication and language development skills are needed to develop ability to start and maintain conversations. Cognitive skills to improve on imaginative play. Again, the word cognitive over here refers to the mental functions that are neurons that are carried out by our neurons. So we also need to improve the cognitive skills. We have to understand and to understand the nature of the cognitive skills a child is having or a child possesses. We have to measure the IQ of that child. Academic skills, that helps the child develop learning skills in reading, writing, drawing, and math, because it is not possible कि हम उसकी schooling or we can separate the child from the other population. Many times autistic children also study with the general population. It's just that they are little bit different. They are not abnormal. We cannot say that they are having any kind of abnormality, because mostly autistic persons have some or the other skill. They are extremely, immensely talented in some or the other field. So communication or social, sensory, behavior, and motor. So these intervention can be categorized into these categories. In communication or social interaction pattern, we will focus on the speech. So first we'll try to develop the speech. We'll try to explain how to talk. We'll try to explain the meaning of the words used by the child or used by the family members, so that again we'll have to focus what kind of intellect the child is having. Second comes social skills programs. Through social skills programs, we can train the child how to socialize, what kind of terminologies to use while communicating with others, how to behave with others, how to behave with people who are elder to you, how to behave with people who are with you or of your age group, and how to behave with people who are with your young age. Next comes applied behavior analysis. ABA is again another technique used by clinical psychologists and other therapists, which again helps the child to develop in a proper way. RDI, relationship development intervention, again as a method where we try to develop the relationship of the child with the other people in his or her life. That may involve the family members, that may involve the parents, that may also involve the teachers and the classmates or seniors, etc. DIR or flow time, developmental individual differences, relationship-based model. Here we'll try to explain them what kind of relationship, what is meant by relationship, and what kind of relationship the person is or the child is sharing with others. Music therapy, we try to engage the person in musical activities, and musical minded autistic persons in general are very good in certain kind of art. So it can be either music, it can be a drawing or some other skill. There are certain other techniques. Medicines are also used, but again, it is very important to understand that medicines are not given to cure autism. Medicines are in fact given if the autistic person is having any kind of violent or aggressive. Many times they become hyperactive, autistic children or autistic person become hyperactive many times. At times they also become violent if they are not liking something, or if something is done which they are not happy or which is not pleasing them, which they don't want. So in that case, they may react in a certain violent or aggressive behavior. In that case, we need to give them medications. No medication can improve the core signs of autism spectrum disorder, but specific medications can help control the symptom. For example, certain medications may be prescribed if your child is hyperactive. Antipsychotic drugs are also sometimes used to treat severe behavioral problems, and antidepressants may be prescribed for anxiety. So medicines will be given basically for anxiety, for symptoms of anxiety, for symptoms of depression, and if the child is hyperactive. Keep all healthcare providers updated on any medications or supplements your child is taking. The main modality, treatment or intervention modality of autism is not just one person. In fact, it requires a teamwork. It requires multiple professionals get involved with that particular autistic person. Behavior and communication therapy. So first and most important, psychiatrist is the person who will prescribe medicines. Second comes the clinical psychologist. Clinical psychologist is the person who will try to understand or assess the level of the autism of the child. So he or she will carry on assessment tools, the tools which we have already studied. So he'll apply tools on the person and then understand the level of the autism of that person. Then comes therapist, psychotherapist. In psychotherapy, again, psychotherapy is given by clinical psychologists, counseling psychologists, and psychotherapists also. So behavior and communication therapies, these therapies are important because we have to understand that when a person is having autism, if I'm diagnosing a person with autism, then there has to be some or other behavioral issues in that person. Through applied behavior analysis, what we use is that we try to help them develop the process of learning. We try to help them learn fast in a faster manner. Then we will use certain methods of reward and punishment with these children. It tracks a child's progress in improving his or her skills. It can help children learn new skills and generalize these skills to multiple situations through a reward-based motivation system. So if an autistic child is behaving in an appropriate way, if the child has been taught something and he is doing that activity in a very beautiful way, then we will award or we will reward the child. We will appreciate, and that token of appreciation is through the certain kind of reward or motivation system. And these will be done so that we can encourage, or we can increase the chances of same behavior in future. It includes specific intervention targets coupled with positive reinforcement, which may involve verbal praise, wow, wonderful, very good, excellent, etc. These kind of, then we can also use tokens. We can involve edible rewards, which can involve chocolate or some eatable, etc., which might be the child's favorite. Second therapy or modality comes as positive behavioral and support, PBS. It aims to figure out why a child does a particular problem behavior. So this here we'll try to understand, we'll try to find the rationale behind a particular problem behavior. If a child is depicting any kind of problem behavior, for example, if some guest is coming to autistic child's home and the child is not liking, the child might oppose it by banging his hand or his legs or his head on the wall or something like that. The child might oppose it through certain repetitive behaviors. The child will not communicate. He or she will not say that I don't like this uncle or auntie coming to my home, but he will communicate the same message through some other clues. We have to understand these clues. We have to understand what kind of problem behavior a child is having, and then on that we'll have to work with again a team. It works to change the environment, teach skills, and make other changes that make a correct behavior more positive for the child. This encourages the child to behave more appropriately. Second comes the PRT, that is pivotal response training. These takes place in child's everyday situations, and its goal is to improve a few pivotal skills such as motivation and taking initiative to communicate. You have to understand one thing, that a child who is having, or a person who is having autism, often lacks communication skills, often avoids initiating a communication. So they won't come, or autistic person won't come to you and start talking on by his own. So through this PRT, we have to initiate how to communicate. We have to encourage them to initiate a communication, because it again needs a lot of confidence. So we have to develop that confidence in the child or the person. Early intensive behavioral intervention, EIB, provides individualized behavioral instruction to very young children with ASD. It requires a large time commitment and provides one-on-one or small group instruction. Again, when a person is having social issues and social skills, what we can do is that we can involve that autistic person with other group of person who are having the same disorder. And through this group involvement, we can initiate the development of social skills in the person. Discrete trial teaching, DTT, it teaches skills in a controlled step-by-step way. The teacher uses positive feedback to encourage the child to use new skills. All these therapies are actually given in various kind of setup. The parents or the family members can take the autistic child to some centers where these therapies can be provided by therapists, or also there are certain things that the therapist comes visits to home also. Secondly, Third, there are certain daycare centers where these therapies are given, where parents are in their work, involved in their work, but the child remains in that daycare center all the day long. He tries to develop, the therapist over in that center tries to develop his skills which are lagging in the child. So DTT involves skills in control step by step, where the teacher uses positive feedback to encourage the child to use new skills. So through DTT, we encourage the child to use skills he or she is having. Educational therapies, children with autism spectrum disorder often respond well to highly structured educational programs. Successful programs typically include a team of specialists and a variety of activities to improve social skills, communication, and behavior. So behavioral problems are found commonly with autistic person. Social skills are lacking in autistic people, and also communication skills. So these three core areas are basically worked into, so that we can improve the overall growth of that person. Occupational therapy is very commonly given therapy for ASD. Here we can do, what we can do is we will help the child in activities of daily living. Activities of daily living means the child might have to change the dress on his own. He might feed himself or herself on his own. How can it be done? So with these activities, ADL, activities of daily living, are taken care of through occupational therapists. So child's trunk and upper body strength, joint range of motions, and involved muscle tone of the child's body is strengthened through this method. Fine motor milestones are identified, and if they are not up to the mark, if they are not properly as per the age group of the child, then people work on this. Eye-hand coordination, manipulation of objects within their hands, sensory, sight, smell, hearing, touch, taste, awareness, and activities of daily living are all taken care of through the occupational therapist. Speech therapist. Through speech therapy, we try to work on the communication aspect of the person who's having autism. So when we understand that this particular person with autism, that person may be a child, or that person may be an adolescent or a grown-up also. So the communication pattern or communication, that way of communication is lagging. So here we try to focus on how to improve the communication of the person with autism. So focuses on improving communication and feeding skills, involve oral motor development, verbal language skills. AAC is another commonly technique used with autistic person. Augmentative and alternative communication involves gestures, sign language, picture communication programs, social communication, and feeding therapy. During the initial evaluation process, a speech language pathologist, SLP, will assess child's understanding of language and their ability to communicate through non-verbal and verbal gestures. So additionally, SLCs can evaluate your child's ability to chew and swallow food and liquids to develop a treatment plan. So speech therapy is again very common, important modality which is used in this. Next comes social skill training. Why socializing is important? Because whenever a child grows up, as in when the child grows up, he or she has to interact with various other people in the society. May it be friends, may it be starting from the family members, of course, and then friends, classmates, teachers, extended families, etc. Or the child might go to certain get-togethers. So socializing is again very important. Through social skill training, we will focus on conversation, that how to initiate a conversation. Secondly, how to maintain that conversation. You have to also to understand that what kind of topic is being talked about, and if I have to respond to that particular topic, or if I have to respond to what I'm being asked about, then I have to use these kind of terminologies. Handling teasing. Many times autistic person are bullied, many times they are teased. So how to handle these also is another part of the social skill training. Being a good sport, showing good host behavior during play. Great. Professionals use various techniques in this social skills training. First is role playing, that will allot a particular role to the autistic person and then ask him to behave in a particular way. So this is known as role playing. Social stories will ask the child or the person, autistic person, to tell some stories. That story can be either what he or she might have read in the books or might have heard from his parents or family members, etc. Social stories. Social scripts, we ask them to read the scripts, and through reading scripts, speech is taken care of. Then comes sensory integration therapy, SI therapy. It can make a real difference by helping individuals to manage their sensitivities and cravings. Autistic person are having various kinds of sensitivities, having various kinds of cravings. So they crave for the love and hug of a mother, or they crave for love, and many times family members get irritable, get irritated because of their behavior, because of their banging or their careless kind of behavior, or not serious into something, things like that. So this is worked through sensory integration therapy. Its goal is not to teach specific skills or behaviors, and integrate sensory information to allow the child to interact with the environment in a more adaptive fashion. Unusual sensory responses are common in children with ASD. Sensory activities may be helpful as part of an overall program. So these all therapies are, I'm just telling you about the therapies because you should know that if you're having a family member who's having autism, what kind of treatment modalities, what kind of intervention plans are available, and who are the people who who are into this field, who provide therapy for these people. Remedial intervention involves the use of sensory and motor activities and equipments like swinging, massage, etc. Accommodations and adaptations, wearing earplugs or headphones to diminish noise, or using a textured sponge in the shower. Sensory diet programs involves a daily menu plan, which includes individualized supportive sensory strategies, that is quiet space, aromatherapy, weighted blanket. Physical activities and tangible items are also used, which involve stress balls or other items for distraction. Environmental modification is important because autistic people are used to, or they love the atmosphere or the environment they are into, and if due to some reason there occurs any change in that particular environment, they might dislike it, they might not like it, then they might not even communicate, they might not oppose and communicate, they may behave in particular way, and that particular behavior will depict that they are not okay with this change. So environmental modifications should be done only and only according to the choices of the child or the autistic person. So we should not involve any noisy machines. We should try to have a certain soothing kind of environment that can involve various kind of artwork, and the furnishing also, the furnitures involved over there and the cushions and all those things should be something like which should not provide any kind of harm to the autistic person. Education for involved individuals, including family members, caregivers, and administrators, about the influence of sensory functions on performance and ways to minimize the negative impact on the function. Physical therapy is given to strengthen the strength of the person with autism, because in general we can help them also to improve gross and fine motor skills. Physical therapy will help them in gaining strength of the body, in trying to understand what kind of muscles can be controlled, or how can we control the muscular movements, motor skills, and how can we bring about a coordination in. So through gym and all those things, it can be worked upon. Family therapy, again, family members become very impatient if there is an autistic person in their family. And many a times they also need some counseling. They also need therapy. And in family therapy, we will talk to the family members who is having an autistic member, and one by one try to understand their psychology, try to understand. We also need to help them vent out, because they are also frustrated because of the autistic person's behavior, and their frustration also needs to come out in a healthy way. So through family therapy, first we can help them vent out, we can help them share their emotions and feelings, their pains, their struggles, their restlessness, their irritability, etc. And once they share it out, they will feel relaxed, and they will have a zone that yes, now I'm feeling quite relaxed, I'm feeling quite lighthearted after sharing my all restlessness or my all emotions with the therapist or the psychologist or the counselor. And now it's clear that yes, now I'm feeling lighthearted, and I can now help in dealing with a child autistic person in a better way. Second, it promotes social interaction skills. Then manage problem behaviors and teach daily living skills and communication, because here family members are the people with whom the autistic person prefers to live with and generally communicates mostly with them only. So here family members also need to know certain things. Art therapy, we involve autistic person in certain kind of artistic things like any sculpture or drawing or music, or any skills with the person with autism loves. So we have to understand what appeals him or her, what appeals that person with autism, what are the interest areas, what are the core interests his or she is having. Developmental therapy, here we will try to understand what are the developmental delays and how can those developmental delays be worked upon. See, it is not important that it is not possible that if a child is having any kind of developmental delay, a therapist or a mental health professional will rectify. But what we can do is we can help them cope up with it. We can help them that yes, I'm having these developmental delays and these are my shortcomings, so I have to live with it, and this is how I have to behave. So we will help them get adapted to it. Some of the best regarded developmental therapies involve flow time, relational development intervention, RDI, SCERTS, which involves social communication, emotional regulation, and transactional supports. Here we have to work on multiple areas. We will work on the social and communication skills of the person, how emotional regulation, or what kind of emotions is the person with autism having, what kinds of emotional lows and highs that person is having, how does that person communicates or expresses himself, how does it what kind of transactional support is that person giving, because many times they often go through bully, they often go through teasing and all those things to various members of the society. So how to deal with it is being taught in the developmental therapy. Animal therapy. Animal therapy can be done either at home also and at therapist place or therapist center also. So we can also do one thing, that we can give them pets. But again, we have to be very careful in providing pets to the person also, because when they do not have that much IQ that how to behave in a certain way with the animals also. From hippotherapy, therapeutic horseback riding, to supporting animals and service dogs, animal therapy has been found to have a significant positive impact on children with autism. It can help children build confidence, expand their social skills, and even increase core body strength. Nutritional therapy will try to provide a proper diet, a healthy diet, because people with autism uh, do not socialize. They actually try to remain in their own zone. They try avoiding coming out of their own shell. So we have to focus on these aspects. We are not supposed to we shouldn't insist any certain things on them. We should not force anything on them. So these things should be easygoing. So proper nutrition and diet is also very important. There are certain myths and facts about autism that people are having. So many people feel that autism is something which is a God's act, or it is something punishment given to a person due to bad deeds or old deeds, etc., etc. So let us understand what are the common myths and facts of autism. And one common myth is individuals on autism spectrum disorder avoid social contact, or autistic people are antisocial. So they are not antisocial. It's just that they are not very much into making friends. They are not very much into communication. But if at all they are communicating with one or two person, they will often develop a very cozy relationship with that person. So they do not socialize with everyone, but once they socialize, they are very good into it. So individuals on the autism spectrum disorder are often keen to make friends, but may find it difficult. As an it's not that they don't want to make friends. They do, but somewhere or the other, due to other person's behavior, they step back. Individuals on the autism spectrum cannot lead independent and successful life. No, people who are having autism are also living successfully individually on their own. All individuals on the autism spectrum have special talent or 7 skills. So special talent is something which is associated with autism, and which is in generally actually true in many cases. It is estimated that 10% of individuals on the autism spectrum may have special abilities in areas like music, art, mathematical calculations, memory, or manual dexterity. The majority, however, may have areas of high performance that relate to their special interests or obsessions. Next comes is bad parenting can cause autism. No, autism is a neurodevelopmental disorder which can be caused due to various reasons, but parenting or bad parenting cannot be the reason of autism. Autistic children are more violent. They do become violent, but only if you mess with them. But only if you do what they are not willing you to do. So if you do something which is against their actions, which is against their wishes, then they may get some violent. Girls don't usually get autism. Autism is commonly found in boys, but in girls also it is found, but it's more common in boys. Now, there are certain tips for autism spectrum disorder parents. See, here managing intervention of people, autistic people is one thing, but at the same time, parents also need to know a lot of things, and parents also need to take care of a lot of things on how to manage their person or a family member with the autism. Raising an autistic child is not an easy task, first and foremost important thing. It can be challenging for parents to handle an autistic child, and again for the family members. If there is another sibling in the family, or if the family is a joint family, then the other family members may face a lot of difficulty because of the autistic child. Also, some tips to ensure the quality of life of your autistic child and the entire family. In India, in our country, there are approximately 1.4 million people with autism, and many are still unidentified and or misdiagnosed. The journey of making an autistic child take care of himself is not easy. It begins with the grief and despair of parents when their child is diagnosed as autistic. So it in itself is a very shocking thing for parents, that why my child is having autism, or how now what can a child with autism, what are the things with a child with autism, parents with autism has to take care. First and most important thing, pace yourself or prioritize self-care, because if there is a family member who is having autism in your family, then you have to constantly keep running up behind that person. You have to constantly take care of that person. Constant monitoring becomes very important, because once you get your sight out of that person, there can be certain things which might go beyond your control. As parents, patience exists quickly when we are stressed and overwhelmed. Most ASD or autism spectrum developed disorder kids are sensitive to their parents' anxiety, which intensifies their own reactions. Keeping calm during meltdowns and practicing mindfulness help me to develop. This is a statement used by a parent who said that while my child was having autism and the way the child used to behave, I practiced mindfulness. Mindfulness is a technique which keeps you to relax yourself, which you will keep on talking to yourself. You'll use certain techniques to relax yourself, your body, your mind, your soul, and then again you will develop a strength, a positive strength in yourself during high stress periods rather than feeling defeated. Simple activities like meeting friends for lunch, going to bed early, starting a new novel, to take the kids out for some time, or the other parent can give a break, have break, does wonders for pushing that reset button. So it is very important that we get drained out of a parent of an autistic child gets drained out by constantly running behind or taking care of that autistic child. So here we can also distribute responsibilities between the parents. Focus on the positive. Just like anyone else, children with autism spectrum disorder often respond well to positive reinforcement. So if we provide positive reinforcement to the autistic child, the child will definitely respond in a very healthy manner. So the child will understand. So it's very important to understand that yes, the child does understand what exactly is reinforcement, what exactly is encouragement, what exactly is praise, etc. And the child will in turn feel good when you are appreciating him or her. Be specific so that they know exactly what you liked about their behavior. Find ways to reward them either with extra playtime or small prize like a sticker. So we can reward them on certain kind of behaviors. Stay consistent and on schedule. It is very important again that you have a particular schedule. There are certain parents who are working but who are also having an autistic child, and they may have to make a balance between their work and their family member or the child with the autism. Make sure they get consistent guidance and interactions so they can practice what they learn from therapy. When parents and family members go for therapy, you have you have to take care that what kind of things are taught in the therapy sessions and how to follow the things that are being taught in the therapy sessions, because homework is also equally important over here. The things taught in the therapy sessions are supposed to be implemented at house also and with other family members also, and this can be ensured by the parent. Get off the internet, step away from the search engine. Search engine is will not provide you that how to manage my child with autism. So try to not find out questions on your on the search engines. At the same time, we can get on the internet. Get on the internet, like get on social networking sites where there are certain groups on autism. There are certain uh, communities where autistic people get together, or where families of autistic people put their viewpoints, etc. Talk to other parents, get to know them, not just what they did to treat xyz, etc. So we can also try to talk to them, to know their experiences, to know what they did, to know their do's and don'ts with their family members or with autism. Autism can make parents feel very isolated. Sometimes it is hard to get out and network. Facebook, Twitter, and online groups are awesome. So we can also get in touch with people who are having family members with autism. Celebrate quirks and talents. Understand what strength your autistic child is having. So if we understand their strength, if we understand their weaknesses, we can work on both. We can enhance the strength, and we can also try to diminish or reduce the weaknesses the person is having. Enhance peer relationship, since autism is something which directly targets on the social aspect of the child. So we can do over here is encourage the child to get into contact with the classmates or peer group also. Try to encourage them to initiate a conversation. Once they initiate a conversation, the other child will also respond in a welcome manner, and then our child with autism will develop a sense of confidence. and healthy relationship might develop. Take your child along for everyday activities. Socialization is one aspect, but everyday activities also is something which an autistic child must know. So if we are going, we can take our autistic child to grocery shop or to market or to or to bank, to some bank, or these things are something which an autistic person, as the person grows by, he or she might have to learn these things. So we can give them training on this by taking along with us as they grow. Accept your child for who they are. Many parents get frustrated, get irritated, and they keep complaining about their child, that my child is this, my child is that, and that I'm fed up of my child, I feel like running away from home, etc., etc. Your frustration is genuine, very genuine. You as a parent are not able to see your child in problem, or see your child not healthy, as competent as other children. So it is very much genuine concern, and getting frustrated is also okay, but you cannot do anything. That cannot be. Autism is something which cannot be undone. You cannot go back and just change it, right? So you have to accept your child as he or she is. Acceptance will actually help you reduce your frustration. Become an expert on your child. Again, every autistic person has different needs, has different symptoms. Even if the typology or subtype is the same, is common, two people with Asperger's syndrome, two persons with Rett syndrome, or any other kind of subtype of ASD will have same symptoms. But at the same time, they might be somewhere or the other different. So try to understand the basic needs of your child. Try to understand the signs and symptoms of your child, because a child may get violent, but again, violence, level of violence, extent of violence may vary from one child to another. So a child, if he's not liking something, may just get quiet. He or she might not say anything. At the same time, if other child is not liking people coming in their room or coming to meet them, they might start opposing by either not talking to them, or by banging their hand or their legs, or some other behavior. They may depict some other behavior. So we have to understand the needs of our autistic child, of our autistic family member, and then we have to customize what intervention we have to give that to that person. Allow yourself a pity party. Again, here we can, because the frustration of having a autistic family members is genuine, so we can also vent it out either by shouting or moaning or crying, or whatever you feel okay with. So just take it out. Just take it out from within, deep within. Just remember, you still have a kid that needs you. So to take care of that autistic child, you have to take care of yourself. If we keep on complaining that my child is that, my child is that, or if we keep on crying or on ranting certain things, then we'll not be able to take care of ourselves. And we have a child to take care. We have an autistic child who needs his or her mother the most, or the family member the most. Make time for fun. We can also involve in funny activities where we can play with our child. We can also play as a group, as a family. We can involve in ourselves or other family members in certain kind of play activities with our autistic family member. Create a personalized autism treatment plan. Here we have to focus on certain questions. What are my child's strengths and their weaknesses? What behaviors are causing the most problems? Because this again may vary from various autistic persons. How does my child learn best? What does my child enjoy, and what does my child likes, and what the child does not likes? So these are certain questions which needs to be taken care by the family members, and we have to tailor or customize the intervention plan accordingly. Thank you so much. Any queries? Any queries?